Dr. Jelin, sometimes kids don't seem to be gaining properly in the beginning, and they're referred sometimes to gastroenterologists. Why would that be?
Well, the gastroenterologist seems to have taken ownership of food, and it's clear that without ingesting enough food, the kids aren't going to grow. Frequently, we see kids who eat poorly and don't gain weight because they're not getting enough calories. Very often, these children are pressured by their family to eat, and it becomes a battle. The kids always win the battle, and they don't eat well. The other reason that the gastroenterologist sees kids who don't gain weight is if they are ingesting enough calories, but they're malabsorbing those calories. In other words, the body can't incorporate those calories appropriately, then there may be a cause of, there may be a gastrointestinal disease which is preventing that absorption from occurring.
So, do some kids don't digest food?
Some kids do not digest food.
And you have discussed many times a term we use a lot, lactase deficiency. Milk, sugar, enzyme, they just don't digest it. Is that a common condition or uncommon?
That is an uncommon condition. In infants, it is much more common as kids get older. It is usually associated with gas and pain, but not really with failure to thrive.
What about milk allergy? We hear that a lot of time. How common is milk allergy?
Milk allergy outside the newborn period where is quite unusual also. We do see infants who are small infants, the ones we mentioned with streaks of blood in the stool, the ones we mentioned who get better with colic or spitting up when they're taken off milk, but most often, these kids are able to tolerate milk without any problem by the time they're a year of age.
But a good pediatrician will plot the growth. If it's going sort of like the same growth percentile, and then as a drop-off, there's concern. But if it's the same growth percentile, you may be a small kid, but you can live with that. But they drop up is a little bit of a concern.
Right. You always have to look at the heights of the parents. Often parents are short and often very slim, and kids will track the same way their parents are for genetic reasons. So it's important to track those kids, and I think it is important to make sure that they continue on whatever pathway they have previously been on, even if it's a pathway that's below where we normally see kids.
So the growth charts are very important in plotting a kid if you're worried about a problem.
That's correct.
And you have to look at the parents.
That's correct.
Sometimes we have to find questions out because you never know who the real father and mother are. Sometimes a little bit of a problem today, these mixed families.
I'm not going to go there.
Okay.